Could you please tell us more? What is a hair transplant?
For a person who has a male pattern baldness or something called androgenic alopecia. In transplant, what we exactly do is we extract the donor, we extract the healthy donor. The overall procedure will depend on the area of coverage as well as the number of grafts. If the donor is good, then we can expect a good result. They need to take care of their lifestyle.
Hi everyone, welcome to Cutis International Dubai First podcast, where we're going to explore all about aesthetics and cosmetology. My name is Salam, and today we have a very special guest, Dr. Devi. Due to the unhealthy lifestyle that we're all having and the stress of our daily life, I believe many people are suffering from hair loss and hair issues. Today we're going to discuss more with Dr. Devi about the hair transplant and hair treatments. How are you, Dr. Devi?
I'm good. How are you, Sil?
I'm good, alhamdulillah. Thank you. It's a pleasure having you with us today.
Me too.
So, doctor, tell us more. You know that nowadays many people are considering the hair transplant procedure for hair loss issues. Could you please tell us more? What is a hair transplant?
So, hair transplant is just like any other transplant. It is mainly for a person who has been through a male pattern baldness or something called androgenic alopecia. And there are different grades of androgenic alopecia starting from grade 1 to grade 6. So if a person who is going through overall thinning of hair, he will not need transplant. Whereas a person who has any grade of baldness will go for transplant. So in transplant, what we exactly do is we extract the donor, we extract the healthy donor, and then we implant it to the area where it needs to be done.
Okay, so that means not everyone is eligible for a hair transplant. So who really is eligible for this hair transplant procedure?
Before hair transplant, we need to talk about a condition called androgenic alopecia, which is mainly due to a genetic cause. Also, a person who has a family history of androgenic alopecia, the person will go for overall thinning. It is a gradual happening. It won't happen in a day. So that person, initially he can go for treatments like PRPs or any injectable treatments. Like in current days, we have a lot of exosome stem cell therapy, growth factor injections, and that can help the person to maintain his existing hair. There is a person who is never bothered about all those things and he is in the last stage of hair thinning. That person will really need transplant.
So doctor, tell me more. How long does this procedure take?
So the overall procedure will depend on the area of coverage as well as the number of grafts we extract. And if a person who is going through grade 3 of baldness, or so the person will only have hairline correction. Say for example, if a person is going for a hairline correction, so it will take maybe around 5 to 6 hours. Whereas a person who is in grade 6 who is planning to do overall correction, then it will take around 8 hours.
I think most of our audience are wondering if it's a painful procedure. So is it a painful procedure?
So firstly, it's a minor procedure and it's a daycare procedure. Could be the duration is so long, but we anesthetize the area to be done, and the person will not feel a pain during the procedure, and it's a tolerable procedure.
So since you mentioned it's a bit of a long procedure, as you said, how long does the patient need to rest after the procedure?
As I mentioned, it's a minor procedure. The person no need to take a bedridden rest. It's not mandatory, but after the procedure, maybe for the first 2 days, he will feel some kind of discomfort over the scalp and a kind of heaviness. That will be relieved within 2 days. And the overall treatment will need rest for 10 days for the scalp or the implanted area to be healed.
Okay, so doctor, tell me, is there any other treatment alongside the hair transplant procedure that the patient needs to undergo after the procedure is done?
So as we were discussing, there are a lot of injectable treatments like PRP, growth factors, exosome stem cell therapy, which is very much available in the market today. And also the medical treatments like usage of vasodilators, DHT blockers. There are a lot of things are available in the market. And coming to the point, post-care of hair transplant, a person who has a very weak donor area, or a person who would like to go for a transplant with minimal coverage, like for example, if a person needs to do only the hairline correction, but he still has a thinning over the existing hair, those kind of people will need a lot of treatments to strengthen the existing hair. So it is advisable and it is mandatory that the person goes for multiple sessions of injectable treatments like PRP, growth factors, exosomes, as well as we try to take in medications like minoxidil, finasteride, procalcitonin, and so on.
So I believe a person who does a hair transplant would expect like amazing results where we will have a lot of hair after the hair transplant. So can you please tell us more about what to be expected after the hair transplant?
So the result will depend on the donor area. If a person has a healthy donor, he can expect a very good results. And we have to initially assess the donor area through the dermoscope, and we have to finalize, okay, if the donor is good, then we can expect a good result. And there are people who has a weak donor and still they want to get a good results. Yes, they can, but the thing is, again, we have to strengthen the donor area with the use of medications for the first few months, and then we can go for a transplant. We can opt for a transplant. And if a person who doesn't have a donor area but still he wants to go for it, then we can prefer other donor areas like under the chin, like from the beard or from chest hairs, or other body hairs are still preferred for the transplant.
Amazing. So how many times can a person go through a hair transplant procedure?
So to say the truth, he can go for multiple sessions. So the person can go for multiple sessions. And again, cosmetology, you will have to undergo a lot of sessions for the corrections. So if the donor is good enough, then we can go for multiple sessions.
Thank you so much, doctor. So before we end our podcast today, is there any advice you can give to the audience who are thinking of doing a hair transplant, or any advice to the people who are suffering from hair loss about how they can take care of their hair?
So a person who is through hair loss, it could be because of a lot of conditions. Like initially, it could be because of your genetic condition or any clinical conditions or your lifestyle changes. In case of genetic condition, that is unavoidable, and the person really needs to go for medications and other treatment. A person who has clinical conditions such as thyroid issues or iron deficiency or vitamin D deficiency, or a person who is diabetic, then the initial treatment could be controlling the underlying cause. As well as a person who has sleep disorder or increased stress level, they need to take care of their lifestyle. So we have to look into the underlying condition and we have to treat the initial cause.
Thank you so much, Dr. Devi, for being here with us and for the amazing information you shared about the hair transplant procedure. If you're interested to know more about hair transplant, and if you're someone who's planning to go through a hair transplant procedure, please book an appointment at Cutis International Dubai at the below mentioned number. Thank you so much for watching us, and don't forget to like, follow, and subscribe for more informative videos.